SARS-CoV-2 is confirmed as the causative agent of the COVID-19 pandemic. The virus is classified as a novel coronavirus, indicating its emergence as a new strain. Scientists analyze the unique genetic structure of SARS-CoV-2. Analysis of the genetic structure is crucial for understanding the virus's behavior. This understanding is essential for developing potential treatments and preventive measures. The initial outbreak of COVID-19 was linked to the Huanan seafood wholesale market in Wuhan, China. This market is identified as the primary site of the virus's emergence. Conditions within the market are believed to have facilitated the virus's spread. These conditions included the sale of live animals. The presence of live animals created an environment conducive to zoonotic transmission. The market's environment is considered a potential source of the initial COVID-19 infections. SARS-CoV-2 likely originated from a zoonotic transmission. This means the virus jumped from an animal species to humans. The closest known relatives are coronaviruses found in bats. A pangolin is a possible intermediate animal host. The lab leak theory posits that the virus may have accidentally escaped from the Wuhan Institute of Virology. This theory suggests a potential accidental release of the virus from a research setting. Currently, there is a lack of definitive evidence to conclusively support the lab leak theory. Despite the absence of conclusive evidence, investigations into the origins of the virus are ongoing. These investigations aim to determine the precise source and circumstances surrounding the initial outbreak. The virus initially spread from Wuhan through international air travel. Flight routes acted as vectors, carrying the virus to various parts of the world. The rapid global spread was facilitated by international air travel networks. Delayed and unclear reporting from China exacerbated the situation. Opaque reporting hindered timely responses and containment measures. The combination of air travel and reporting issues contributed to the pandemic's rapid expansion. On the 30th of January 2020, the World Health Organization, WHO, declared a public health emergency of international concern. This declaration signifies a critical assessment of a global health threat. It indicates that an event poses a public health risk to other states through the international spread of disease. The declaration also signifies that a coordinated international response is needed. It serves as a formal call to action for countries to implement measures to prevent and control the spread of the disease. The declaration aims to ensure a global, unified approach to mitigate the health crisis. Early in the pandemic, hospitals in regions like Italy, Iran, and New York faced immense strain. This strain was largely due to the rapid spread of the novel virus. The absence of vaccines meant there was no preventative measure available. Similarly, the lack of effective treatments limited the ability to combat the virus once contracted. The concept of flattening the curve addresses managing infection rates during a pandemic. Lockdowns are implemented as a strategy to slow the spread of infection. Slowing the infection rate aims to prevent a rapid surge in cases. A rapid surge could overwhelm healthcare systems. The goal is to maintain healthcare capacity to treat all patients effectively. Flattening the curve helps avoid a collapse of the healthcare infrastructure. Wuhan and Hubei province implemented a strict lockdown to control the spread. Travel restrictions were a key component of the lockdown strategy. Business closures were enforced to minimize public contact. These measures aimed to reduce transmission and contain the outbreak. Italy was the first Western nation to enact a nationwide lockdown. This decision marked a significant turning point in the global response. The lockdown was implemented to control the spread of a novel virus. It had immediate and profound effects on the daily lives of citizens. The national lockdown also triggered substantial economic consequences. Lockdowns were widely implemented across Europe, Asia, and the Americas. These lockdowns included the closure of schools. Business operations were also restricted as part of the lockdown measures. The degree of restrictions varied between different countries. These measures aimed to control the spread of the virus. The global scale of these restrictions marked a significant event. Lockdowns have resulted in devastating economic consequences worldwide. These consequences include severe economic recession in multiple countries. Lockdowns have also caused massive job losses across various sectors. Mental health crises have been exacerbated due to isolation and uncertainty. Education for billions of children has been interrupted, leading to long-term impacts. The global scientific community is undertaking a rapid vaccine development mission. This initiative is characterized by unprecedented speed in research and clinical trials. Collaborative efforts among international research teams are central to this accelerated process. Significant funding initiatives are being mobilized to support vaccine research and production. Global funding initiatives played a crucial role in accelerating vaccine development. Previous research on SARS and MERS provided a foundational understanding. mRNA technology offered a novel and efficient platform for vaccine creation. These key factors collectively enabled the rapid development of vaccines. mRNA vaccines work by introducing a specific messenger RNA sequence into the body. This mRNA contains instructions for cells to synthesize a harmless fragment of a pathogen, such as the spike protein of a virus. Once produced, the protein fragment triggers an immune response. The immune system recognizes the protein as foreign and produces antibodies and immune cells. This process creates immunological memory, providing protection against future infections by the actual pathogen. Regulatory agencies permit overlapping phases in clinical trials. This overlap is intended to expedite vaccine development timelines. The acceleration is achieved without sacrificing safety standards. Overlapping phases allow for quicker progression through the trial stages. Vaccines were first administered in December 2020, 1 year after the virus emerged. This rapid deployment reflects unprecedented scientific and logistical efforts. The distribution of vaccines presented significant logistical challenges. These challenges included production, transportation, and equitable allocation. Clinical trials provide controlled data on vaccine efficacy. Real-world data complements clinical trials, showing vaccine performance in diverse populations. Vaccines are highly effective in preventing severe disease. Vaccination significantly reduces the risk of hospitalization. Vaccines are proven to be effective at preventing death. Effectiveness rates are quantified through statistical analysis of trial and real-world data. Vaccines significantly alter the course of the pandemic. Vaccination transforms a deadly disease into a more manageable condition for most. This transition enables societies to initiate reopening processes. As vaccination rates increase, societal functions gradually resume. Daily life progressively returns to pre-pandemic norms. Vaccines are therefore crucial for the restoration of societal activities. The virus has reached an endemic stage, indicating a consistent circulation pattern. Endemicity implies a stable and predictable level of viral activity within the population. New variants, such as Delta and Omicron, continue to emerge. Ongoing monitoring and adaptive strategies are essential due to continuous viral evolution. Vaccination is a critical method for preventing severe disease outcomes. Vaccines work by training the immune system to recognize and combat pathogens. This preventative measure significantly reduces the risk of serious complications. Antiviral drugs, such as Paxlovid, are also important in managing infections. These medications target specific viruses to inhibit their replication and spread. The use of both vaccination and antiviral drugs provides a comprehensive approach to disease control. Non-pharmaceutical interventions, NPIs, are strategies to reduce disease spread without medications. Masking is an NPI that creates a physical barrier against respiratory droplets. Improved ventilation dilutes airborne contaminants, reducing transmission risk. Testing identifies infected individuals, enabling isolation and preventing further spread. These NPIs are effective measures for controlling the spread of infectious diseases. Long COVID is recognized as a chronic condition that persists after an initial viral infection. It represents a significant and growing concern within the medical community. Extensive medical research is currently underway to fully understand long COVID. This research aims to elucidate the underlying mechanisms and long-term effects of the condition. A key focus is the development of effective treatments and management strategies for long COVID patients. The recent pandemic highlighted vulnerabilities in global health security. Significant weaknesses were exposed in international supply chains. The pandemic also revealed shortcomings in international cooperation. Current discussions focus on improving systems for future pandemics. These improvements aim to address the identified weaknesses in health security. The COVID-19 pandemic is a story marked by both setbacks and achievements on a global scale. Initial failures included delays in early detection of the virus. There were also significant shortcomings in international coordination efforts. These failures hampered the initial response to the pandemic. However, the pandemic also spurred remarkable scientific innovation. The rapid development and deployment of vaccines represent a major success in combating the virus.